Thank you, Mr. Speaker. Overuse of prescription pain medication is one of the leading causes of opioid addiction. When a patient has more narcotic pain medication than they need after a medical event, this excess medication can fall into the wrong hands. And narcotic pain medication in the wrong hands often leads to addiction. In fact, the National Institute on Drug Abuse has found that 1 in 15 people who take non-medical prescription pain relievers will try heroin. Last year, the number of fatal overdoses from prescription painkillers increased by 16% and 28% from heroin in the United States. In West Virginia, the story is even worse. According to a recent study by the Trust for America's Health, the Mountain State has the highest rate of overdose deaths in the entire United States. This issue is above party politics. It's a plague that all Americans must come together to solve. That's why in February, I introduced H.R. 4499, the Promoting Responsible Opioid Prescribing Act. This bipartisan bill strikes a harmful provision of Obamacare that places unnecessary pressure on doctors and hospitals to prescribe narcotic pain medication. This concern was mentioned while meeting with doctors and other healthcare professionals in Charleston, West Virginia, who are active in our state's medical society. I thank them for bringing this to my attention. It's a perfect example of how government works well. You bring an issue to your congressman's attention, and he takes action to solve it. This was their idea. I thank them for bringing it to our attention. I encourage everyone to bring ideas you have to help fight back against the opioid epidemic to your local congressman. I'm proud to say that less than a week ago, the Department of Health and Human Services announced they're implementing the important policy changes contained in my bill. Almost word for word, the new rules are exactly what my bill says needs to be done. Since I first introduced the PROP Act in February, I've been calling on Congress to pass my bill. This bipartisan legislation has 27 Republican co-sponsors and 16 Democrat co-sponsors. My bill puts doctors, not the federal government, in control of opioid prescribing decisions. This change in policy is an important fight against the opioid abuse. I want to thank the 43 co-sponsors in the House and the 8 co-sponsors in the Senate in our successful effort to pass this bill's policies through regulation and help put an end to opioid abuse. Thank you, Mr. Speaker, and I yield back.